start off this segment by talking about the events of pregnancy. So what happens? So pregnancy or gestation lasts approximately 40 weeks for humans, and this varies among animals. And this 40 weeks is really divided into trimesters. So you might hear, a woman's in her first trimester, her second trimester, or her third trimester. So that's just a division of these 40 weeks. So what happens in pregnancy? First, the fertilized ovum or the egg is called a zygote. So the ovum begins as a single cell and then divides many times during the days after fertilization. Next, implantation is what occurs, and this occurs within 2 weeks of fertilization of the creation of that zygote. And the zygote is going to embed itself in the uterine wall. Once that the implantation occurs, then we're into the fetal period, and this lasts the last 7 months or about the last 2 trimesters of pregnancy. During the fetal period is when we have critical periods of cell division and growth and development, and changes in the mother's body are also occurring. So these critical periods, if there are any sort of adverse influences, such as malnutrition, drug abuse, or smoking, this can lead to abnormalities of the infant. We'll talk about more of these on the next slide. Changes in the mother's body are also occurring during this fetal period. So we have our fetus that is growing, but mom is also changing and growing as well. So her uterus is becoming larger to allow for size of the fetus. The supporting muscles are also increasing in size. Breasts are becoming more tender, and her blood volume is increasing due to the increased demands of the fetus as well. As mentioned previously, the effects of malnutrition during these critical periods, so those times of high cell division and development, are irreversible. So if something's going on during development and there's not the adequate nutrition available, your body can't go back and make it up later. So that could cause these irreversible effects. So each organ and tissue type grows at different rates and times, but as mentioned, the development only takes place at certain times. So things in the body are pretty well scheduled out. So you can't be like, oh, I'll get my calcium later to help with bone development of the fetus. It doesn't work like that. When bones are developing, that's when you need calcium. So you need calcium all the time. If nutrients are not supplied or the environmental conditions are not ideal, so if there are toxins around, then the development can be limited. And again, this can cause some irreversible abnormalities or consequences. So some of these examples may be poor dental health, vulnerability to infections, having a higher risk of diabetes, hypertension, stroke, and heart disease. So some of these you may not necessarily be able to see, and they may not be immediate effects, but they definitely have an impact later in life. So some high-risk pregnancy factors. This is from table 13.1 in your book. And these can increase the risk of having some of those abnormalities occur during those critical periods. So as we've talked about before, weight is definitely can increase the risk for pregnancy abnormal outcomes. So low body weight, high body weight, also too much weight gain or too little weight gain, age, too young, too old. We have nutrition-related factors that can that can make a pregnancy high risk. So consuming too much, consuming too little, having an eating disorder, having a lack of access to food, use of drugs, alcohol, or smoking. And then we have other pregnancy-related factors. So how many pregnancies the mom has had before? How long has it been since she was last pregnant? Was it a very short interval or was it a very long interval? How many fetuses are in there? Is she having just one child or is she having triplets? Other chronic diseases that may be present or other genetic disorders or any other diseases in general. So all of those can increase the risk for a high-risk pregnancy. So make sure to review that table. As you might have guessed, nutrient needs are increased during pregnancy. And we'll go through some of the nutrients that are increased the most. So one is going to be our energy. So total calorie needs are increased during pregnancy, but the amount of increase varies with the progression of pregnancy. So remember that gestation is divided into trimesters. So during the second trimester, calorie needs increase 340 calories a day. And then during the third trimester, it increases 450 calories per day. So to increase or to meet this increased demand, a mom could eat more food or she could also reduce her activity. So however she can basically be in a positive energy balance. Carbohydrates, the minimum needed is 135 grams per day during pregnancy, and this is needed for optimal fetal growth and brain function. Ideally, if a mom can get 175 grams, that's better, but 135 grams is really the bare minimum. This also helps to fuel fetal brain and spares protein needed for fetal growth. Fiber is also very important to help alleviate constipation, and constipation is a common problem in pregnant women. So making sure that a woman is consuming adequate fiber can help prevent or reduce constipation. Also being sure with an increase in fiber to drink plenty of liquids. Protein needs increase about 25 grams per day. And most of us are already consuming plenty of protein. So protein supplements are discouraged. For vegetarian moms or especially vegan moms, don't go for protein supplements. Really focus on choosing protein-rich plant sources. So those protein supplements can be damaging to the fetus. So really focusing on whole foods if possible. Due to their key roles in cell production, folate and vitamin B12 are needed in large amounts during pregnancy. So these are really important for increased red blood cell development. So we previously have talked about folate and its role in helping to prevent neural tube defects. And your best sources of folate are going to be enriched or fortified grain products. So remember that there is a federal mandate or federal requirement for fortification of enriched grain products, which includes B vitamins, including folate. It's also important to have adequate folate intake before pregnancy because of its role in preventing neural tube defects. So this is one of those if adequate folate's not available, before pregnancy. And again, many of us may not know that we're pregnant until it's already we're too far in to prevent these defects. So adequate folate is always important. Vitamin B12 helps to assist folate with the manufacture of new blood cells, and foods of animal origin are the best sources. So for someone who is vegan or vegetarian, specifically vegan because they're excluding all animal products, fortified foods or supplements will be needed. So there are other nutrients that are important for normal development of bones and teeth. So we always think about calcium and vitamin D. But phosphorus and magnesium are also important, and this slide is going to touch on calcium and vitamin D specifically. So calcium absorption doubles during pregnancy, and at the beginning of pregnancy, this calcium is deposited in the mother's bones, so it's really increasing her bone health and bone density. Later in pregnancy, calcium is going to be released from the bones and then goes to the fetus. So then her bone density is decreasing later in pregnancy. So adequate calcium is very, very, very important to help preserve the mother's bone density and then to meet the needs of the growing fetus. So the more calcium stores that a mom has in her bones, the better her bones will be maintained once that calcium is being transported to her fetus later in the pregnancy. Vitamin D is important because it helps to play a role to increase calcium absorption and use. And we know that the deficiency of vitamin D is rickets. So rickets can result from poor intake in the child. So if a child starts off vitamin D deficient, it's going to be very hard for them to make that up, and rickets is going to likely occur. Iron helps to increase blood volume in the body. And again, we talked about during pregnancy that mom's demands are really increased. So blood volume is increased as well. Also, a woman can lose a lot of blood during birth, especially if she has a C-section. So this extra iron is very important to help have those adequate number of red blood cells. And again, that's why folate and vitamin B12 are very important as well. Iron absorption increases up to 3 times during pregnancy, again, to help increase those stores because she can lose a lot of blood, but also because this is going to be given to her fetus. So iron needs of the fetus take priority during pregnancy. And this is when a baby is born, the fetus or the infant has sufficient iron stores for the first 4 to 6 months of life. So basically, a baby doesn't need any iron for the first 6 months of life because it has adequate stores from its mom. So it's very important to choose foods that are high in heme iron, so that's going to be our animal sources, or iron-rich vegetables and legumes, and to help enhance vitamin C or iron absorption to pair that with vitamin C. So remember, vitamin C helps to enhance iron absorption. And remember to limit those foods that may inhibit iron absorption or not pair them in the same meal. So like you wouldn't want to have milk with a steak because the calcium in the milk would inhibit the iron absorption of the meat. Zinc is also important for pregnant mothers as it's required for protein synthesis and cell development, and it's obtained from a variety of foods in the diet, including shellfish, meat, and nuts. So most moms don't have a problem meeting their zinc requirements during pregnancy. So what about prenatal supplements? Healthy pregnancy and optimal infant development depends heavily on the mother's diet. So we want to focus on foods first because the mother is better able to use those nutrients. Things are absorbed better. But for some moms, prenatal supplements may be beneficial and may be needed. Prenatal supplements provide more folate, iron, and calcium. So some of those nutrients, vitamins, minerals that we talked about are increased even more in moms. And the women most likely to benefit from use of a prenatal supplement include women who don't eat adequately. So maybe moms that are vegan a prenatal supplement will be recommended. Women who are pregnant with twins or triplets, and then women who smoke cigarettes or are alcohol or drug abusers. All of these groups of women may benefit the most from taking a prenatal supplement, but a prenatal supplement is usually recommended for all women. But again, you would want to talk to your primary health care provider for, what prenatal supplement you should take and any other recommendations or things of concern. And prenatal supplements can help to reduce the risk of preterm delivery, low infant birth weights, and birth defects because they ensure that nutrient needs are being met.